We are now on Module H, the respiratory system. The respiratory system is made up of kind of three regions. We've got our thorax, upper respiratory tract, and lower respiratory tract. Our thorax is the closed cavity of the body that contains the structures that we need to breathe for respiration. It extends from the base of our neck to our diaphragm, and our thorax is surrounded by muscles and bones, and in this case, actually ribs to be particular. Our upper respiratory tract consists of our nose, mouth, sinuses, pharynx, larynx, and the top of the trachea. Our lower respiratory tract consists of the lower trachea, the bronchi, and the lungs. The function of our respiratory system is to breathe in oxygen and breathe out carbon dioxide, also called inspiration and exhalation. As we age, just like every other system in our body, there are some changes that happen. Our respiratory muscles tend to weaken. This includes the muscles of the diaphragm. Our lung tissue gradually becomes less elastic. Our lung capacity decreases. And we have limited expansion of the chest due to changes in posture. As we age, we tend to become a little more stooped sometimes, and so that we don't have that full expansion that we might have had when we were younger. We have more shortness of breath upon exertion. Our lung capacity has decreased. I think I mentioned that. And oxygen in the blood also decreases as well. When we see these variations from the normal, we want to make sure that we're reporting it right away. If we notice shallow breathing or breathing through pursed lips, coughing or wheezing, nasal congestion or discharge or a productive cough, noise, gasping for breath, or too slow or too fast a respiratory rate. Some of these which we mentioned in the Module AA lecture when we talked about tachypnea and bradypnea. If we see cyanosis, that's when we have a change in skin color and the skin appears pale or bluish in color. We may see this in the lips or extremities. If we notice any change in the rate or rhythm of breathing, if we notice that our patient or resident needs to sit after just very mild exertion, if they start to have dyspnea or difficulty breathing, or complain of pain in the chest. Now let's talk about some of the common diseases of the respiratory system. You may have heard of COPD. This stands for chronic obstructive pulmonary disease. This is a chronic progressive disease which causes trouble breathing. It causes trouble in getting the air out of our lungs. So chronic obstructive pulmonary disease can include chronic bronchitis and emphysema. Chronic bronchitis is irritation and inflammation of the bronchi, usually caused by smoking. Someone who has chronic bronchitis, you're going to see these people with that productive cough. They have a lot of phlegm that they're bringing up. They're breathless and they're wheezing. Whereas chronic emphysema, this is a disease of the lungs that's usually a result of chronic bronchitis and smoking. So these people, they're going to be coughing a lot. They're going to be breathless. They're going to have difficulty breathing. They're going to feel like they can't breathe. And their heart rate's going to be increased. There is no cure for this. It is irreversible. Patients who are chronic emphysema sufferers are usually on oxygen. When the lungs do not get enough oxygen, it is going to eventually affect all body systems, right? Because all of our body systems, all of our cells need oxygen. And where that oxygen and gas exchange happens is in the lungs. So residents with chronic lung disease may live in constant fear of not being able to breathe. You're going to see these people often having to sit up. They can't even lie back or lay down to sleep. They have decreased appetite. They don't sleep well, which leads to further weakness, poorer health. They feel out of control, and they fear suffocation. For residents with COPD, sometimes even speaking a sentence can take their breath away. Just having small bites of food and chewing and eating a little bit can take their breath away. So some signs of COPD: a chronic cough or wheeze, difficulty breathing, shortness of breath with exertion. They may have that cyanotic skin, okay, confusion, weakness. They may have, as I mentioned, difficulty finishing meals because of the shortness of breath, and they may just live with a lot of fear and anxiety. Our role in helping with residents who have COPD and respiratory issues is to sit them up and forward. We put them in this tripod position, which helps to expand their lungs as much as possible. Because of the difficulty these COPD patients have with meals and sometimes fluids as well, we want to offer small, frequent amounts. We also want to encourage the practice of pursed lip breathing, which is going to be initially taught by the nurse. It's essentially the inhaling, you slowly inhale through your nose and exhale slowly through pursed lips. And there's a video of this under this lecture. If someone has oxygen, we always want to observe for oxygen in use signs, keeping in mind that as nurse aides, we are never allowed to adjust an oxygen setting, whether that be turning it up or turning it down. Oxygen is actually a doctor's order. So even as nurses, we have to wait for the doctor's order to deliver certain amounts of oxygen. Now, the one kind of thing to keep in mind is if you go into your room and you know Betty is always on her nasal cannula, which is oxygen that goes up through the nose, and you notice that it has fallen off of her nose or her ear, by all means, please put that oxygen nasal cannula back on. But again, we're never adjusting the amount. We do want to be supportive of these residents' fears and anxiety and feelings of suffocation. And we want to follow really great infection prevention principles and encourage rest periods. Now, infection prevention principles, this is important to mention. And why is this on here? Well, because anybody with any kind of chronic illness, because of what chronic illness does to our body over time, puts us at a higher risk for infections, for becoming susceptible hosts. So it's going to be really important that we practice really good infection prevention principles with our patients with chronic obstructive pulmonary disease or other chronic illnesses. Because of that, if we do notice a resident may have any early signs of a cold or not feeling well, we need to make sure that the nurse is aware, because these illnesses, especially respiratory illnesses, can make COPD worse. It can put someone into a COPD exacerbation. If we notice changes in breathing or lung secretions, mental state, excessive weight gain, or that the resident is starting to become increasingly dependent on the staff and family, we want to make sure that our nurse is aware of this so they can address it. Pneumonia is another common respiratory issue. This is an acute infection of the lungs that may be caused by a bacteria, virus, or fungus. A lot of times when people have pneumonia, they're going to have chills, cough, high fevers. They're going to have that green or yellow sputum or phlegm, chest pains, or a rapid pulse. Again, going back to those patients with COPD as well, they are a very great risk for developing pneumonia, especially if they're weakened for some reason. The recovery is longer for both older adults and for patients with COPD. Asthma, of course, you've heard of asthma. The picture of the on the left is the blue vessel. This is a healthy bronchial tube. The red is an unhealthy bronchial tube, and that's the image of someone having an asthma attack. As you can see, the unhealthy bronchial is constricted a lot. And just like we had mentioned earlier, it's for asthma patients, it's more of an issue a lot of times with getting the air back out of the lungs. Asthma is a chronic inflammatory disease that occurs when the respiratory system is hyperreactive. It overreacts to irritants, whatever they may be, and they're going to be different for everybody. It could be pollen or dust, cat hair. So our respiratory system is reacting quickly and strongly. Exercise and stress can worsen this. When the bronchi become irritated, they constrict, making it more difficult to breathe. And responding to the irritation that our respiratory system is feeling and the inflammation that is occurring, our body actually produces more mucus, which is actually not exactly what we need in this moment. Because if you can imagine, not only now are your bronchioles constricted, but now you have a lot of extra mucus blocking them as well. So again, this is air getting trapped in the lungs, causing coughing and wheezing. Residents with asthma should avoid their triggers or irritants. There's also just the common cold or upper respiratory infection. This can be viral or bacterial. It's an infection of the nose, sinuses, and throat. We've all had a respiratory infection of some kind at some point. You have nasal drainage, sneezing, we may have a sore throat, fever, and just feel really tired and kind of crummy, right? Our body's immune system, especially when we're healthy, excuse me, can usually take care of an upper respiratory infection on its own, just with time and work, extra fluids, extra rest, staying away from smoke or irritants. Often sitting up can be a little more comfortable. And again, it will just heal with time. And it doesn't hurt to mention again that if we have a cold or if we have a resident who has a cold, keep them away from those people who have COPD. So in general, when it comes to the respiratory system in our role, we want to provide periods of rest at intervals to not exert our residents. We still want to encourage, though, exercise and regular movement. Encourage and assist with deep breathing exercises. These are going to help to clear the lungs of, extra mucus and secretions. We want to limit exposure to smoke, polluted air, odors, especially by residents who have these respiratory conditions. And of course, like I mentioned, when it comes to the respiratory system, as nurse aides, one of the best and quickest and easiest things we can do is position our residents to maximize lung expansion. And that concludes the respiratory system.